Hi, Dr. Blair. Thank you for joining us today.
Hey, it's great to be with you, Mitch. It's my pleasure to be able to work with you and all of the medical professionals out there trying to change people's lives with cannabidiol.
Yeah, so I'm bringing you in. I'm a health coach, and I have a medicinal CBD company that works with some of your products with Elixinol. And
Terrific.
I've been doing this a few years, and I've learned a lot in dealing directly with physicians, healthcare practitioners. But you've been doing it a lot longer, so I'd like to glean some information from you, especially with the bigger picture, the overall health and wellness aspects, because that's what I focus on as a health coach. Really getting people, well, not every diet fits every person, or more specifically, there's diets out there that aren't a one size fits all.
I
So,
agree with you. Yes. There are some
so
certain parameters that are there that we know that about 60% of the population does not tolerate refined carbohydrates, and that's a major problem. And that's consistent with the amount of obesity that we're seeing in the country.
yeah, thank you for bringing that up. So part of what I talked about with the group is getting those good fats in our diet. And we've gotten the wrong understanding that fat is bad. It causes fat or it causes problems. It's really the carbs that are causing the problems, and a lot of the hypertension and the diabetes that is out there right now in our society.
Absolutely right. You know, obesity and carbohydrate intolerance leads to obesity, and then that leads to diabetes. And I think we're going to see an epidemic of other conditions like kidney disease, eye disease, as well as Alzheimer's coming as a result of that intolerance to carbohydrates, the refined carbohydrates that we're facing on an everyday onslaught in the stores.
Right. So my first question I have to you, well, first of all, do you want to introduce yourself as far as your background a little bit? That would be great. If you can tell us a little bit about you have a medical practice, so just talk a little bit about that.
So I went to the United States Military Academy. Then I went into the Army. I was 3 years in family practice, and I've been practicing medicine for about 40 years now. About 3 years ago, I learned about cannabidiol, explored the literature, started using it in myself, my family, and clients, and found just enormous benefits that I had never thought possible with traditional and current contemporary medicine. So this has opened up a whole new world of the treatment possibilities in many orphan conditions that have not been responsive to current medical therapy.
Orphaned. We'll get into that a little bit later. I want to dig into that a little bit. So it's great. You have a lot more experience than I do, and that's why we're having you here today. So my first question is really back to what we were talking about before with the fats. How do you see shifting your diet towards higher intake of fats versus carbs, and how does that lead to balancing out your endocannabinoid tone and therefore your overall wellness?
Well, during the past 50 years, we've been misaligned. We've been told about a theory of that fats cause disease, and in fact, the reverse is true. What we're seeing in the evidence and reviewing the evidence and seeing it in many case examples is that good fats really make a difference in terms of changing the quality of life, the inflammation in the individual, and correcting for many of the problems, including endocannabinoid deficiencies. Now, the good fats that I'm talking about are omega-3s and saturated fats and monounsaturated fats. Polyunsaturated fats tend to be problematic in that they lead to inflammatory molecules and signaling substances that cause problems rather than relieve problems. Now, the American Heart Association has been very strongly focused on cholesterol, even though that Framingham studies and other large studies have proven that that is not a significant factor, and yet they're continuing to use that as a surrogate marker for heart disease and potential. As a result, they're recommending avoiding saturated fats, and I think this is a wrong thing to do. In fact, saturated fats are good from good quality sources, along with the omega-3s and the monounsaturated.
Yeah. No, I'm glad you brought that up. Recently, there's a lot of posts, and I'm commenting on a lot of people about this information about coconut oil, because coconut oil, as you know, it's high in saturated fat, but it's the monounsaturated. It's the good, right?
No, there's a mix in almost all in coconut oil. There is a mix, but mostly you're dealing with the saturated fats. And the evidence on the short chain or the medium chain triglycerides that are in coconut oil is that they convert to signaling molecules themselves, what are called ketones, and they signal the body anti-inflammation, and they help to feed different cellular components like the brain and like the colon that can be involved in a number of diseases.
Can you say that these types of ingesting these types of fats are kind of precursors or the building blocks to this endocannabinoid system that we're talking about here today?
Exactly. As some of the key cannabinoids are actually made up of these types of fats and saturated fats. Recently, I learned about two specific endocannabinoids that rely on the fat intake in order to maintain their balance. And these are anti-inflammatory substances that are signaling the body in a number of different ways and orchestrating normal, orchestrating homeostasis. And so returning people back to a balanced clinical health standard.
Wow. That's great. Merging the two worlds I love to talk about.
But that's just saturated fats, because omega-3s are essential for cannabidiol and the other endocannabinoids to work, because they are also precursors or involved in the enzymatic mechanisms that are involved in the endocannabinoid system. So these things, these particular fats are really essential for balancing the endocannabinoid system when it has been made deficient as a result of trauma, poor diets, and poor nutrition, or toxic substances.
So like a supplement, taking CBD or eating the right fats can help just get your body the raw materials to function properly.
I think the combination is really important, particularly for the omega-3s, along with CBD at a maintenance dose. You don't necessarily have to feel an enormous change as a result of that, but maintaining that is going to maintain homeostasis. It's going to keep your body healthy and actually protect you against some major problems that might come up, like stroke or malignancy.
Wow. So I've been reading a lot about this term endocannabinoid deficiency syndrome. And when you start to understand some of these conditions like fibromyalgia, migraines, and some of these other conditions that are, in my mind, when I read about it, it ties into this endocannabinoid system. How does CBD work with these types of conditions to help balance out?
Well, it's pretty phenomenal that CBD, and this is a major theme that I have, is that the cannabidiol is working directly in a number of different areas, but it's also working on the baseline in raising up the endocannabinoid system, balancing both the number of receptors as well as the number of active endocannabinoids. So it's raising both of those and balancing them so that you're getting a normal function in the endocannabinoid system and controlling that system, restoring that system to its optimum condition.
So I've never heard that before. Increasing the receptors?
Oh, actually, it's decreasing the receptors. In many of the conditions like PTSD, there is a plethora of empty receptors, and that probably comes from an endocannabinoid deficiency in that there's not the number of agonist molecules that are activating. So the body responds by building up more receptors so that it can react. Unfortunately, that particular pattern may be self-defeating in that they're not responding. And when you get those back into balance and seeing the number of receptors and the amount of endocannabinoids in balance gets that restored system functioning at its optimum.
So what condition would you say, I mean, I know what I experienced over the past 2 years, the top conditions, but what about you as a practitioner yourself? What do you see as far as being the most responsive from your patients for taking?
Those are, several questions there in terms of what people come to me about. Number one probably is pain. Second is anxiety. And then the other is depression. And then I'm dealing with a lot of those orphan conditions, as well as cancer. Those are the top ones for the most part. I'm really sponsoring and pushing for PTSD and treatment with CBD because of the dramatic results that I've seen with such low doses.
Yeah, let's talk about that a little bit. So PTSD, you mentioned before, I instantly think of the veterans, guys coming home from overseas. That's a small portion of it. There's much more. Can you talk a little bit about how and what you've been experiencing?
Right. Certainly the veterans, and deservedly so, get a lot of the attention that comes out about PTSD. But they really represent only 30% of the total PTSD population. There's some estimates as high as 10 million people in the United States that are afflicted with it. And the main problems and the main people affected are actually women and children, and best that I can tell. And you look at the data when you see that child abuse represents a 50% likelihood of developing PTSD. And then sexual abuse or a sexual attack is associated with a 35% incidence of PTSD. On top of that, women are more susceptible to endocannabinoid deficiency because of their body's response and their particular needs.
Wow. So just supplementing, a certain amount, everyone's different, as we talked about before, to get that relief. And you're seeing for PTSD, they're getting their life back in order and under control. There are different nightmares and fears and anxiety associated.
That's right. So with PTSD, of course, you're dealing with the loop circuit where you're re-experiencing traumatic situations like a nightmare that's going over and over and occurring in the daytime as well. There's a hyperarousal, a hyperactivity that you really, there's a sensitivity to any sound or noise or to any triggers that you might encompass. There is withdrawal. So you're withdrawing, you're getting out of the public eye, you're getting away from your friends. And then there's these bad feelings that you have, and it's either depression or anxiety or that you, even to the point of suicide. And unfortunately, there is a fairly high rate of suicide among people who have PTSD. So something always to consider.
Yeah. That's important information there. Thank you. So a couple other questions, kind of going in a different direction now, taking it up a little bit higher with some of the comparisons between, there's two compounds out there. There's the infamous THC, and then there's what we're talking about here today, the CBD. And there's also kind of two different camps. There's the hemp-derived people due to the fact that it's high in CBD, low in THC. And then there's more of a group that feels that it's the THC that's doing a lot of the medicinal therapies. Why is there a conflict? It's all cannabis sativa across the board. Why does it seem like there's a little bit of tension between these two groups?
I'm not entirely sure. I think that people feel like we're arguing about some of the details. How big is your thing? How big is my thing? How effective it is? I don't understand, because fundamentally we agree that cannabis is quite an extraordinary herbal substance that's been used for over 5,000 years, and that the whole plant is healthy. It's the best way to take in. The pharmaceuticals, they are isolates, and they don't lead to all of those benefits that are there. And that's one of the reasons why some of the pharmaceutical drugs have failed or have been associated with a number of complications. And the third thing that I freely admit is THC has real value. There's no doubting it, and that's well supported in the literature. But you run into a couple problems. Number one is, where are you going to get your product from? Where's the standard? There isn't any. There are legal issues that are involved with THC. And I have to talk about my experience level working with CBD alone without any significant amounts of THC. And I've had superlative results with less than 3% of people requiring an additional THC in order to control their symptoms. Wow. And finally, the availability. You can get CBD, high quality, reliable, with clinical support without any difficulty throughout the U.S. and in 22 countries.
Right.
So, we have so many things that we agree on. It's really hard to understand why we're bickering about the amount, and when it really is the amount of THC that's in the product, and coming to almost to conflict about it.
Yeah. Yeah. So it's good to have somebody like you at my fingertips because of those, the background behind the marijuana. I don't like to call it marijuana, but that's the only way to distinguish it sometimes. Because access, not everyone here in Pennsylvania, we have a medical program they're building the infrastructure now, but not everyone's going to qualify for those 17 conditions, serious medical conditions. So yeah, this is accessible and remarkably safe too. Some people don't like the psychoactivity of the THC, and it causes a little bit of the opposite effects of what they're trying to get. So to be able to have somebody like yourself, it's great. I can, I have some people with complex conditions, epilepsy and Parkinson's, and they need a little guidance because they're taking some pharmaceuticals. Awesome. Thank you so much for your time.
Oh, it's a pleasure.
I think we touched on the what we needed to go over. I'm going to let my fans here know that we can access you at any time.
That's great, and I wish you the greatest success, Mitch. I want to stand by you and reinforce that and provide the science and the evidence and the clinical support for you to carry forward and transform everybody's life.
Thank you so much.